We actually create whatever brace we feel we need. So it started off where you would just use a strip, but now they call it the universal nail correction. So we can make, like when it comes to misshapen nails, we've managed to get them to grow properly by sometimes putting a T or an H and sometimes covering the whole nail. But basically we put it on, cure it like a gel nail, and then it just grows out over time.
Okay.
But it holds the shape. So in your case, it would be holding this flat piece in the back. If we put it on there, it'll just grow out with the nail and keep it from curling.
Okay, yeah, awesome.
Yeah, like I do think that it looks like they've done a good job here last time when they did the removal, but I think if you want reassurance, that's a good way to go. And it could push this stuff out for you.
Okay, cool, yeah.
Yeah, it doesn't hurt, only takes a few minutes, and it's usually just $10 anyway.
That sounds good.
You just try to cover the material because it doesn't really help us when people don't want the treatment. Because then the problem doesn't get better, right?
Yeah.
Okay, let's see. I think that's just pressure. I don't think it's attached there. Does that hurt at all?
Nope.
All right. So, let's see if I can get my nipper under there, and otherwise we'll use a burr to file it thinner. Because it's yellow, technically it shouldn't be attached here. But I can't get under it. There we go.
Oh, yes.
Got it. Does that feel okay?
Yep.
No pressure?
No pressure.
Awesome. And here.
Just gonna leave you just.
Looks like sometimes if there's any bleeding at all, then it dilutes the chemical.
Yeah. So he kind of had the chemical like in there longer than most other doctors have done, but
Interesting.
yeah, he kind of, this is how I've been doing it for a while, and it seems to work. So
There's also, we learned 2 different kinds of chemicals too, and one has a better track record.
okay,
And I don't know if one is easier to access than the other, or...
I'm not too sure. Yeah, okay, interesting.
Yeah, well, see, we had a podiatrist scheduled here,
Yeah.
but her spouse is moving out of country, so we had to cancel. But yeah, I had been ordering supplies, and it was interesting the stuff we learned.
Okay.
There we go. So this tip was really growing down into the end of your toe. Were you feeling that pressure?
Not too much.
It was,
Maybe a bit.
it was
Yeah.
clubbing, yeah. I think it's going to feel a lot better now that I see how far down it was pushing. I think it'll feel better after we finish today.
Okay.
Thinking about a tea with a lip.
Maybe. I'll see how much. I think I can get a lot of this out with the little burr. But that will work if we don't get it all out of there. Perfect. So we're gonna lift just slightly. You tell me if it's too much pressure. How does that feel?
That's fine.